Hi, I'm Dr. Rich. I'm teaching you about dentistry and teeth so you can have a very nice smile.
Thanks for joining me today. So today we're going to be extracting this painful lower incisors, that one I'm touching there with my Explorer. And as you can see, it's very crowded in there with all the other teeth. And on the x-ray, you'll be able to see actually all the incisors are in really bad shape, a lot of bone loss, but that's only that one tooth that's causing pain and trouble for the patient. So he only wants that extracted. So first I'm trying to use my ash forceps, not enough room. So this is going to be tricky because I got to get in there and remove that one tooth and try to keep the rest in. So all the time I'm trying to pull this tooth, I'm using my fingers to kind of hold the other teeth in. And I have to use a really thin tipped instrument. I'm using my straight luxator. And again, you can see my finger there, keeping the other teeth from moving just so I can tease out that one tooth. The tooth is very loose. It's just kind of wedged in there a bit, but I think we got it now and moved it out. And then I'm going to use my finger forceps to remove it out, to remove it the rest of the way. So why are we pulling just this one tooth and leaving the other three poor condition teeth? Well, patient has pancreatic cancer and just finished a round of chemotherapy, and he's not really up for mentally and physically to getting multiple teeth pulled and getting flipper made, whatever. So he just wanted to take that one tooth that was really bothering him. So I'm going to place some Benecel into the extraction socket just to help with any bleeding issues, hopefully help prevent a dry socket. There you can see the blood popping up through the middle of the Benecel. Now this material too will just get resorbed it'll break down and get resorbed by the body as it heals. And so the person doesn't have to come back to get it extracted. So I'm just going to cram that down, pack that in. You want it packed in tight, but not super, super tight. You kind of get a feeling for it. And it just helps, acts as a scaffolding for the blood clot. So the person, I did have the person come back a week later to splint the remaining front teeth. So I took I bonded some Rib-On, it's a fiberglass type of material, onto the back sides from the canine to canine, and just kind of bridged that space where the missing tooth was, and I bonded it to the other three incisors just to make them all one piece, to make them nice and stiff. And he said it felt much better afterwards. Unfortunately, the patient passed away about 2 months after this visit due to the pancreatic cancer.